Dental anxiety affects more patients than we think. We never take it personal. We have a lot of patients, doc, no offense, but I just hate being here. I love you guys, but I just don't like being in the chair. It's a common phrase that we hear. And my biggest, what makes me smile most, what makes my day is when at the end of the procedure, they're like, you know what, this wasn't that bad. Dental anxiety is something that's an inner fear. It's something that could be started from a traumatic experience as a child. It could be something that they just had a bad experience at some point and just said, you know what, I'm done with it. So we first listen to the patient. We try to see where it's coming from. We're trying to see how we can combat it, whether it's with sedation, whether it's with medication, nitrous oxide, which is the common laughing gas. But many times it's just calming the patient and letting them know that we understand, just explaining every step of the way, explain the procedure so there's no surprises. There's many forms to relieve that anxiety, and we try to look at all aspects. Of course, first the non-medication approach, and then we always have the options, whether it's, like I said, sedation, oral sedation, nitrous oxide sedation. Those are all options. I remember a patient that would always cry in the chair before starting, and she was in her 50s, and she would just say, "Doc, I'm sorry, I know I'm gonna cry," but and that's how she always start the appointment. And this was seeing her as a new patient. What made my day was maybe 2-3 appointments later, she wasn't crying anymore. She was more comfortable in the chair. And I knew that we succeeded. I knew that we turned a patient that was anxious, that had a bad experience, someone that just didn't like coming to the office, and somebody that actually liked hanging around the office, somebody that was proud of themselves because they made it. They became more courageous. For me, courage means one thing. It doesn't mean that you're never afraid. It doesn't mean that you never have fear. It means that you conquer your fear. And that's something that I'd love to see in patients, where they really become courageous. It's coming in fearful and conquering their fear.